Hey everybody, AJ LeJ here, and I am back with another video. So today I'm going to talk about a few more things that I forgot to mention in my other video about gastric weight loss surgery. Things like, is it worth it? What's the difference between gastric bypass and VSG, which is the vertical gastric sleeve? Just a whole slew of things that I did not put in my other video. So if you're interested in stuff like that, make sure you like, comment, and subscribe so that you can see more content like this. Anyways, let's get into this video. I had a lot of comments and stuff on my last video about, different things that I didn't add into the video. So I have my notes down here. So if you see me looking down, y'all, that's why. Was the gastric sleeve worth it? So for me, and everything that I say in this video is going to be based off of my experience, and I need y'all to keep that in y'all mind. Like, your experience is going to be different from my experience. Like, everybody's body is different, and I noticed that, like, over the years, with knowing multiple people who had the surgery, I got mixed reviews from different people. So the only main advice that I can give to you, if you're currently like in the beginning stages of your VSG or gastric bypass journey, do a whole lot of research, a lot of research, and then make sure that you don't base your experience off of somebody else's experience. Because I'm telling you, in this like whole experience of VSG, everybody's experience is different. Is the gastric sleeve safe long term? So for me, the gastric sleeve has been safe for me at now the 5-year mark. The thing is though, I have not lived a very risky lifestyle since having the VSG surgery. So when it comes to like drinking a lot of alcohol, stuff like that, like, to be honest, y'all, I probably drink alcohol maybe 4 times a year, if that. Like this year, I think I just drank yesterday, but before that, I think I might, yeah, it's probably been like 4 or 5 times a year. I don't drink like that. So when it comes to my period, I don't take ibuprofen. Like, maybe if I do, I'll take it the first day. Sometimes I may take 2 pills depending upon like how bad my cramps and stuff are. But I do choose to do like holistic routes, like heating pads and drinking tea and stuff like that, instead of going straight to medicine. Because I'm not sure if you know, but it's certain medicines that you're not able to take after you have the VSG surgery, and I believe ibuprofen is one of them. You aren't supposed to take it because it erodes, and I believe it causes ulcers inside of the your stomach lining. So like the first year or two, you are not able to take ibuprofen. I believe they do tell you that you're able to take Tylenol. I'm not all the way sure on that, but I will do my research, and I'll make sure to add it either to later on in this video or in a follow-up video. So with the gastric sleeve though, it is, with any surgery, there's a possibility of complications. But so far for me, I never had any complications or anything after I had my VSG surgery. Next thing is, what are the benefits of having gastric bypass gastric sleeve surgery? So of course, weight loss. Duh, that's the like main reason why people sign up to have this. But also, it has been seen that it like does away with diabetes, and people who go in who have, I believe it's type 2 diabetes, it does away with the diabetes. Also, it improved cardiovascular health, long-term remission from type 2, so yeah, type 2 diabetes, permanent relief from obstructive sleep apnea, relief from joint pain, relief from depression, and social isolation. So if you didn't look at my previous video, I did like point on the fact that before I had my weight loss surgery, y'all, I was not going out. I was depressed because I was overweight, all the rest of that stuff, and people just was acting weird towards me because I had gained so much weight in a short amount of time. And because of that, I was isolating myself. So every time they seen me, it was like I was getting bigger and bigger and more unrecognizable. So yes, it does do away with social isolation, because that was one of the things that I sat there and dealt with. It did have me, I was, going out and doing more things because I had more energy to do that, because I wasn't just, like tired and just overweight and feeling just like I didn't want to do life. Relief from gallbladder disease, relief from pregnancy complications in female patients, and improved fertility. So, as I stated in my last one, yes, y'all, I forewarned y'all, if you are not trying to get pregnant after having this surgery, make sure you get on birth control like ASAP, as soon as you are up and like, feeling good or whatever. Especially if you out here doing you, or you got a husband, because once you start losing that weight, baby, he gonna be on you, okay? He gonna be on you. And literally, I got pregnant the first 6 months of having my surgery, so it did. And like I stated in my last video, y'all, I was not like getting pregnant for the 4 years after I had my last child. And then within 6 months, because I had gained all my weight within that 6 months, baby, I was pregnant again. Once I had lost like 40-50 pounds, I ended up getting pregnant or whatever. So my fertility ended up coming back. So if that's one of the things you were wondering about, having weight loss surgery, say you haven't had children yet, and you're like, I'm wondering why you would, your spouse or whatever, and y'all wondering why y'all not or haven't been able to have kids yet, it could be due to the fact that you're overweight. If you are a woman who is thinking about having VSG surgery, that can contribute to your infertility. So VSG does help with that. Next, how painful is the gastric sleeve surgery? For me, I didn't really have any pain because everything is laparoscopic, meaning like, they don't cut you, they just make small incisions. For me, it wasn't that painful. Like, even afterwards, like when I got up and I had to walk and stuff like that, I'll say maybe at the incision points, I had mild pain, but it was maybe like a 2 or a 3 on the scale. It wasn't nothing that was like outrageous. You get what I'm saying? So, can you drink alcohol after gastric sleeve? So I pointed on this, but I didn't go into detail a few minutes ago. You can drink after gastric sleeve surgery, okay, but not within the first 6 months. And I done seen people do that, where like 2 months, a month after surgery, they think they about to go out to have drinks and stuff. Me personally, I did not drink until a year after I had my surgery. Mind you, I don't drink like that though, so it was easy for me to do because y'all, I have a plain type of just diet in general. Like, I'm more so like food. I don't really eat sweets like that, and I don't drink juice. You are supposed to do a minimum of 6 months without having alcohol. After that, you could talk to your doctor and be like, hey, am I at the point where I can have liquor or not? And they will tell you. But yeah, I didn't. And then not only that, but your alcohol content ratio does change after surgery. So, baby, if you, I can't tell you the science behind it. After having the surgery, 2 glasses of wine or alcohol is the equivalent of having 7 glasses of wine or alcohol before you had the surgery. So people are able, like people who have VSG or gastric bypass, you get drunk way faster than somebody who hasn't had it. And it causes you to become alcohol or alcohol tolerant. I believe that's what it's called, where you'll be able to build up tolerance if you overdo it. So like, don't do that. Okay, just stick to having like one or two drinks when you first having the surgery or whatever. Just stick to having like one or two drinks and let that be that. Like, don't be overdoing it, because you'll look up and you'll be like, what in the world, did somebody drug me? And it's like, no, it's because your like how your body filter the alcohol out now is different since you've had the VSG surgery. So next, what is the recovery time for the VSG or gastric bypass surgery? Normally you stay in the hospital for around 1 to 3 days. If you have had any complications or something, you probably will be in there more than 3 days. But for somebody who hasn't had any complications or anything, you will normally be in there from 1 to 3 days. After that, once you get home, to go back to like normal, regular physical activity, it's normally like 3 to 5 weeks. Your FMLA may give you 3 to 6 weeks, just to give you that extra week or whatever off. But by the time 6 weeks come, you full back, doing you or whatever. You go on vacation, you can do whatever you want to do. I believe you are not able to go swimming or anything the first 4 to 6 weeks, and I believe you are not able, so I lied, unless you're driving. Well, I don't even think you can drive. Yeah, you should be able to drive, but airplane wise, I don't believe you're able to go on the airplane a month after you, like 4 weeks after you have the surgery, because they don't want you to end up being at risk to have is it a blood clot? I believe it's a blood clot, like a blood clot in your lungs. I believe they did tell me that, like, hey, you can't like go flying or doing anything like that until the 4th week after having the surgery. But yeah, that's the normal recovery time for the surgery. I did get questioned with which surgery is better, gastric sleeve or gastric bypass. It is all dependent on you, your lifestyle, what your BMI is, how much weight you are. Like, it's all dependent on that. Me personally, I guess at the time when I made the decision, I didn't want my body to be permanently like rerouted, because with the gastric bypass, they reroute your intestine and they take some of your intestine and stuff out. I didn't want that. I just wanted a simple, like, just simply cut the extra stomach that I done stretched out and just make it a slim little tube. That's all I want. I don't want y'all rewiring and rerouting and I don't want y'all doing all that. So that's the reason why I did the gastric sleeve. But of course, everybody's each its own. Do your research, and you will then be able to decide which one is better for you. Next thing, can liquids stretch your stomach after surgery? Yes, they can. Yes, they can. I'm not gonna say, well, yeah, it can, but also like overeating, impulse eating, binge eating, all of that stuff are the main contributors to you stretching your stomach back out. You sitting there drinking water all day is not gonna really stretch your stomach out. But if you're sitting there drinking water and just constantly eating, like, overeating, you feeling sick and all the rest of that stuff, and then you letting that feeling pass by and then you go back to eating, that's what stretches your stomach out. How much weight should I be losing after having a weight loss surgery? That, once again, all depends on your BMI, how much you weigh. Normally, when you go to your surgeon and have your appointments with your surgeon will tell you how much weight you're gonna lose. For example, with me, my surgeon already was like, oh, you're only gonna lose about 80 pounds because of my BMI, my height, like my physical composition or whatever. He was just like, yeah, you're gonna lose 80 pounds, and it's gonna be harder for you to lose less than that, because once you become overweight, and it also depends on how long you were overweight, that's what determines like how much weight you're gonna lose. So based off of how long I was overweight, my BMI, my height, all that stuff, he was like, you probably just gonna lose around 80 pounds. And to be honest, that's how much I lost. And I've been like stuck in plateau at that 80 pounds for about 3 years now. I'm starting to inch into the 150s now. My goal weight is like 140-ish, 140, 145. I'll be fine. I'm more like muscular. So if I tone my arms, all that stuff will end up going down and I'll look smaller than a 140 or 150. So if I only get down to 150, 145, but be toned, I'll be fine with that. So that would then put me, I believe, at like 95 pound mark that I lost. So yeah, like how much you should be losing after having a weight loss surgery, it's all dependent on you. In my mind, like I think everybody should minimum lose around 50 pounds. Like that's a minimum, even if your BMI is like on the lower end to be eligible for the surgery, like minimum 50 to 60. Everybody's body is different, and you got to talk about that with your health provider. How quickly do you lose weight after surgery? For me, y'all, I lost I think 20 pounds that first month. I lost about 20 pounds that first month, and then after that, for the next 6 months, I believe I was losing 7 to 8 pounds a month. And then I finally had plateau around when was it? October. So it was about a year and like 4 months after having the surgery, I plateaued at 160. And ever since I was pregnant with my daughter, I've been at 160. Like right after I had her in November of 2019. I had the surgery in June of 2018. So I've been 160 since November of 2019. And I haven't, like, of course I fluctuated. I gained maybe like at most, y'all, since I've had the surgery, I gained back 8 pounds. But then I lost it all. So like right now, literally as we speak, I'm sitting at 160. I cannot get lower than 160, y'all. I have no idea why, but look, last week I was at 158. So I don't know. I think I just gotta try a little bit harder. Okay, so the next question I wanted to talk about was what medications you are not able to or are able to take after having the gastric bypass surgery. Medications that you should not be taking after having gastric bypass surgery are aspirin, ibuprofen, Alka-Seltzer, Pepto-Bismol, cortisones, and naproxen. Y'all, I have taken these at least one time in my life. So make sure, you watch out and don't take these after having the surgery, because they do cause ulcers in your stomach, and they can cause, complications and stuff in weight loss patients. Make sure that you talk to your doctor about this before surgery. Like, let that be one of the questions that you ask, so that they can give you even deeper, details, and to make sure that they don't have this on the list when, they send your medications and stuff home after having the surgery to manage your pain. Next thing that I wanted to talk about was your pre-op diet. So once again, it all depends on your weight, your height, your size, your BMI, all that stuff. But normally the pre-operative diet starts around a week to 3 weeks before surgery. Normally what I would do if I was you, I would ask your doctor about what these pre-op diet requirements are, so that you can be prepared. and to run out to the store and get everything that you need. Yeah, so they're gonna have you reduce your carbohydrate intake, and then probably like a day to 3 days before the surgery, they will put you on like a all liquid diet. It normally has something to do with your liver. I know that's what my doctor told me. He was like, yeah, you have an enlarged liver, because a fatty liver rather, because with you being overweight. So they say, just like he said, I had a hernia. I don't feel like I had a hernia, but all of this is extra coding that they could put on your bill to the insurance company to get extra money. So that's a total different subject though. Yeah, normally it has to do with your liver, and they're trying to like shrink down your liver so that when they do the surgery, they won't be sitting there, like nicking your liver, because, or having a hard time getting around your liver to get to your stomach, allegedly, but whatever. Next thing, how much does gastric sleeve or gastric bypass cost? Normally, on average in the United States, it is around 50 to $100,000, depending upon what state you live in and all of that stuff. But on average, $50,000. Normally insurance pays for it. My insurance paid for it. I believe it paid for 80% of it, 85% of it, something like that. All I know is out of the $50,000 bill that I had, I only had to pay $2,000. But normally, like I said before, if you got Medicaid or something like that, they pay it like 100%. Most insurance companies will pay for it, because so many diseases that come with being morbidly obese, that it'll cost them less money in the end to have you have this surgery and just paying that $50,000 than you being morbidly obese and them having to pay for medications and other surgeries from the joint pain and the sleep apnea, and you know what I'm saying. Like, when you have the weight loss surgery, it does increase your quality of life. So normally, like in the areas of like romantic interest, because you got your confidence and you able to, because I know with me personally, I couldn't dress how I wanted to dress. Clothes became a little bit more expensive, because of course now you got to go to, like, you can't just go on some of the little sites or whatever. But actually now, to be honest, well, with me being my age, I can go on Fashion Nova and stuff like that. But older women, they may not want to go on Fashion Nova and stuff like that. So if they're trying to go to Banana Republic and stuff like that, they can't really do that because they don't have their sizing. But yeah, so it does help with your confidence, your self-image, romantic interest, because now you smaller, you able to fit into different kind of clothing. You able to style yourself a little bit different. It's some girlies, it is some big girlies who they like, regardless, I'm stepping, period. Whether I'm a 3X or whether I'm a dang on size 2, baby, I'm gonna come stepping either way. Some people are able to do that, but not everybody is able to do that. Your stamina and your energy does increase, which gives you a better quality of life, because you're able to get up, walk, you're not having joint pain anymore. You're not getting stiff anymore, which normally when people start to get stiff, they stop moving. And when you stop moving, your body and your health kind of deteriorate a little bit faster. So because now you have more stamina and energy, you get what I'm saying, baby, your quality of life it increases at least 30 or 40%. So, and also it reduces anxiety. So that was one of the things that I dealt with heavily when I was overweight, because I was so, like, I'm not gonna say, well, yeah, I was fixated. I was fixated on, my health, but also like how I was looking, how I was coming off to people, and what people thought of me with me gaining so much weight so fast. And not really having a support system and stuff like that. Like, I really was like, I had a lot of anxiety. I didn't like being around people. I didn't like going places, because I would overanalyze the social interactions to where it gave me like high anxiety to the point where I just isolated myself and I just went back home because I didn't want to be in those situations. Like I was just very, very uncomfortable. So it does increase that. So now, you know, when I'm into social situations, oh, and then not only that, but with me being bigger, like y'all, my body, like my body odor, like it changed, and I had to put a lot more effort and time into like keeping myself clean. So that also gave me anxiety when being social, because it's like, okay, well, am I stinking? Like, did my odor expiration clock, is it going off now? Because, like, you know, when I was, before I had my children and stuff, you know, like I could go, you know, an hour or two, 3, 4 hours, a whole shift. I could go a whole work shift and be good. You get what I'm saying? I could last until when I got home in the evening, you know, take a shower or whatever. But y'all, when I was like heavier, it was only lasting maybe 4 hours, and then I started smelling myself, and I'm like, what is going on? You get what I'm saying? So it was seeming like, y'all, I was working in a factory or something, and y'all, I just had a little desk job. Yeah, like it was. So that also gave me anxiety, you know, with social interactions and stuff. So with me losing weight and stuff like that, I wasn't having as much like bad BO. You get what I'm saying? Oh, and that is another thing. Like when you first have the surgery, your body does go through something called ketosis. So baby, that's what I believe you had that within the first like month to 4 to 6 weeks of having the surgery. Just stay inside. Just stay inside, baby. Just stay inside. Like you know, y'all remember when the keto diet and everything was a big thing or whatever, and everybody was talking about how they was going through ketosis and how that smell was just like, yeah, you go through that like the first month, like that your body, you know, is getting used to the weight loss surgery, because of course you're on an all liquid diet, so you're dramatically reducing your carbs, and because of that your body goes into ketosis, and you end up having that ketosis smell, which no deodorant is gonna help that, baby. That's just pure detox, of the body. Another thing that, like, now I'm just like remembering stuff or whatever. Another thing, y'all, your skin gets lighter when you lose weight. Look, I'm not gonna tussle with y'all in the comment section. I am not tussling with y'all in the comment section. But I will say, baby, when I was overweight, all of this was black. Okay? It was black. Once I started losing my weight, it disappeared. I haven't had a black neck or like hyperpigmentation on my like skin since I had the weight loss surgery. So it's been 5 years. Well, I say that first year I lost all of the dark pigmentation that came with me being overweight in my neck and you know, like right here. And then I believe I was dark up here. I started getting dark up here and through here. So yeah, all of that disappeared within the first year of me losing weight. Like as I started losing weight, like my face it got lighter. I don't know. But y'all remember, let me know if y'all remember when Jasmine Sullivan lost a whole bunch of weight and they said that she was bleaching her skin. So she would be like a prime example of when you lose weight, your skin lighten. Like, I don't know why it happens, y'all. I swear, not trying to open up that can of worms of bleaching and all the rest of that stuff. But yeah, when you lose weight, your skin tone does get lighter. Next thing, eligibility for the weight loss surgery. Are you a candidate for the weight loss surgery? So I wonder if I should put this inside of a different video because we're already at like 30 minutes. Y'all, this is the end of this video. I am going to make more videos with other questions about VSG and the gastric sleeve surgery. So if you want to see those videos, make sure you like, comment, and subscribe so that you can get notified anytime I upload. So anyways, thank you guys for watching, and I will see you in the next video. Bye.